Hello, everybody. This is Dr. Bob and Dr. Kaysen DeMaria. We always get so excited the last Wednesday of the month because we get to come to you live, and we're going to be talking about female hormones. And we have a few props, some new props tonight, and I think you're going to be really excited about this.
So all my ladies out there, show us some love that you're tuning in. I like seeing the hearts, the faces. Put your favorite emoji on over there, and just share the love with us. And if you have any questions or comments, I would encourage you to share that. So, Dr. Bob, there's often confusion, I think, with women's health and women's nutrition products. And people, especially ladies, we want to know, what do we need to take? Just tell us what to do, because I know women out there and moms, they're balancing all these different things, and they just want to know, what can I do to stay healthy?
Well, you know, we have an array of different items here I want to talk about. There's a couple real key organs for the ladies. This is the liver. We talk about the liver a lot. The liver has to process estrogen. If you have tender breast and heavy menses, that's a body signal to me that your liver's not functioning at 100%. That's really one of the most important organs in the body. If you look close here, this is the gallbladder. The gallbladder is a reservoir of bile. If you unfortunately would have had your gallbladder out, you really need to get Dr. Bob's Guide to Prevent Surgery, because we go into great detail what you need to do. Tender breasts, heavy menses, you don't want to have an ablation. You really want to contact us. Too many ladies have their uterus cauterized or an ablation, and it's from too much estrogen. That's just one of the starting points. Go ahead.
So we have a couple items here. I know that we have 4 different products nutritionally that we use for ladies, and I wanted to just ask you, first off, 2 things, which I'm gonna show you: liquid iodine as well as iodozyme tablets. And we use Biotics Research Corporation because we know what's in it. And especially if you're taking products at home and you're buying them from places, grocery stores, online, we see your cabinets, you bring them in and you show us them in a box, and a lot of times they have known carcinogens in them, so they could actually be clogging up your liver and other factors and causing other challenges in your body. So we recommend the iodine that we do in our practice. I know it's on our Drugless Doctor website as well, but you want to make sure it's coming from a pure source. So what do you think, Dr.
Well, I'm going to talk about the breast a little bit, and I know that we do the breast thermography in the office, but I'm going to share something that I've learned that is so important, ladies. So when we do the breast thermography, we start seeing patterns of cysts on the breast. So what we have our female patients do is every female listening to us anywhere in the world right now can start applying, and this is clear liquid iodine, so this is not brown, so you're not going to have brown breasts. That's kind of silly, but we had someone that did that.
Quick story: someone did hear Dr. Bob at a health fair, and they came into our office and they saw me speaking at an event, and they said, Dr. Case and Dr. Bob shared with me, put liquid iodine on my wrist. So she held up her wrist and she had brown markings on her wrist, but it's on your breast and you want to make sure that it's clear.
So anyways, especially, that's really silly, but this is so serious, because the iodine, what we have learned from our experience, we've had ladies' breast cysts go away. And you have a story from about a week or so ago. We had someone had a lesion, and they listened to us, and they started applying iodine, and the lesion or the tumor, whatever it was on their breast, it was gone. So I talk about this in Dr. Bob's Guide to Prevent Surgery. I have a whole chapter just on iodine. So you could put some iodine on your breast, because see, your thyroid needs iodine, your breast needs iodine, and so do your ovaries. So we've seen PCOS, or polycystic ovarian syndrome, go away with iodine. So you could apply it on it. That's probably one of the most significant products that we recommend.
Also with women, I know specifically a lot of ladies in our practice, if you have menstrual cramps, I encourage you, start working on cleaning up your liver. And you could have a compromised liver. I know we have some props here, Dr. Bob.
Yeah. Skittles are like death balls, and M&Ms. There was just an article in the Wall Street Journal about all the chemicals in Skittles. And if you crave chocolate right before your menstrual cycle, it's probably a liver issue. So we don't want you to be eating any of those type of things, do we? No. You know what? Let's talk about this, the MG-zyme. And you want to hold up the intestine, Because this
Show us, okay, we're gonna have a little fun. Show us the poop emoticon.
Oh, which we forgot the poop emoticon.
No, we have it out there.
Okay, so somebody flash it up there for us so everybody can see. But in all seriousness, what I see with ladies, they start maybe having heart palpitations, high blood pressure, and constipation. We use a product called MGzyme. Because I know ladies will come in and we'll ask them, do you have a bowel movement every day? And if they drop their head down, you know that they don't have a bowel movement every day. So we use magnesium. We have a variety of them, but if you have a constipation issue, we use MGzyme. If you want to help improve your bowel function, you need to drink water and you need to eat green food because it's magnesium. So magnesium is really important. And we have another product here, which is MCS2. This is a liver cleansing product. So we talk about the liver, but I want to just share this thought with you because this happens to be a replica of a uterus. And when they cauterize it inside of your uterus, which you don't want to have done to you, they're stopping your body from having a natural menstrual cycle. But the real issue is your liver. Please understand that. We talk about that in my book, Dr. Bob's Drugless Guide to Balancing Female Hormones. So we're here to help prevent you from having a surgical intervention. It's pretty kind of frightening, isn't it?
Mm-hmm. And I know that on here, so there's one thing here.
Okay, so you know, Dr. Kaysen, you are in your 30s right now.
Yes.
What can you talk to our audience about? What are you doing?
Well, what's really interesting is recently I had a husband come up to me and he said, so Dr. Kaysen, you're our primary healthcare providers. What do you do to stay healthy? And like, do we need another doctor? What do you recommend? Because I want to make sure my wife is healthy. So I thought this was perfect to share with you. Number one, if you're a woman, you want to make sure you're getting specific chiropractic care because your brain controls everything. Number two, you want to do a breast thermography.
That's right.
And the reason why is because you want to find out what is your pattern and how can you improve that without drugs and with nutrition. And I think the biggest thing, being a millennial and we have technology at our fingertips, you could look something up and then, you know, in a split second on your Apple Watch, you could get your heart rate, your pulse, and that could really cause, I should say, some people fear because they go directly to the medical community and then Dr. Bob, say they're having tender breasts or heavy menstrual flow, they go and they get their annual women's exam and they say, you know what, we found abnormal cells, we need to go in there right away, we need to do a biopsy, and then it just escalates. So I think right now, being in our generation, we have the power that we can start taking care of our bodies now. And I was thinking about this today, and some of you know what I'm talking about. You don't want to be the person that other people are talking about, you know, about your health and all these other things. You want to actually take care of your body so that you can be a role model, whether it's to your mom, your sister, your grandparents, but you want to be the one saying, you know what? Yes, I have things going on, but if we start making changes now, we can make a huge difference. And I think that chiropractic, breast thermography, as well as nutrition is really important for me. And I know that it's not about if you have pain or not, because you could feel perfectly fine and then you get your thyroid panel done and you could have a low thyroid because of stress or having kids, or foods or other things that you might not even be aware of. So I encourage you at least once a year, you want to get a full workup of blood work to see what else is going on so you can be specific in your nutrition.
That was good, and I think that just let's re-watch this, and I think you're going to get a lot. So what's going on? We have something special happening right now?
Yes.
You're so excited.
I'm excited. So
give us some thumbs up.
Giveaways. So this is the first time we've ever done this. So if you are watching tonight, what you're going to do is... Tonight only. Yep. You're going to send an email, okay? All you have to do is you're going to email customercare@druglessdoctor.com.
So what was that again?
customercare@druglessdoctor.com.
Perfect.
With the subject free chapter, and you're gonna get overall a giveaway of what supplements do you need from Dr. Bob's Balancing Female Hormone Books. You're gonna get a free chapter by just emailing customercare@druglessdoctor.com. Put in the subject line free chapter, and that is all yours to help empower other ladies in your life.
That's pretty amazing. I think that you're going to get a lot of good information from this. Thank you so much for watching. Pass this on. It's really a matter of life and death. So we want you to keep your liver going, and we thank all of you, and we'll see you next month. Bye.